Hello and welcome, and thank you for joining us for today's webinar. We're Nesta, we're the UK's innovation agency, and we're committed to tackling some of society's biggest issues. Today, we're here to talk about one of those, which is improving health. I'm Lauren Bowes-Byatt, and I'm the Deputy Director here in the Healthy Lives mission at Nesta. Closed captioning is available on our LinkedIn, and also please do submit any questions that you have for me or the wider panel in the comments section as well. So what are we here to talk about today? Last week, the UK government published their much anticipated 10-year health plan. Within that, they announced a bunch of different measures, including what they plan to do on their shift from sickness to prevention. And that's the focus of today's conversation. At Nesta, we welcomed and supported the focus on obesity. Obesity is one of the biggest drivers of ill health in the UK, and it is an issue that is preventable as well. Today, we'll be digging into that further and the measures that were announced within the plan, much of which were built on the work of the sector, academics, and also those working in government really committed to improving diets across the UK. And specifically within the plan, we at Nesta were really excited to see the announcement of the Healthy Food Standard, which would put in place two core new policies, one of which was around healthy data reporting for big businesses. This is a measure that has been championed by organisations like the Food Foundation and Share Action, plus many others, but also the commitment to introduce healthy targets or healthy sales targets or standards for big businesses and supermarkets. A measure that is inspired by some of the work we've done here at Nesta on healthy targets for supermarkets. Today, that's going to be the focus of our discussion. We're going to talk about what the 10-year health plan means for prevention, obesity specifically, and we'll dig into whether this will shift the dial. We'll also start to touch on what next and what this means for delivery and implementation. So let me introduce our panel today. We're joined by a stellar panel lineup today. We have our very own Hugo Harper from Nesta, who is the director of our Healthy Life team here to cover off all things obesity, but also to focus on the Healthy Food Standard announcement. We're joined by Catherine Jenner, director of the Obesity Health Alliance and a true expert in all things obesity. We also have Jim Dixon, MP for Dartford, an advocate for public health, and here to offer reflections on what this means for his constituents and beyond. And we also have David Buck, a senior fellow at the King's Fund. He'll be talking about what the implications are more broadly on prevention and bringing his many years of expertise on prevention and health inequalities to this as well. So thank you all for joining us today. I'm going to kick off first of all by handing over to Hugo for some opening remarks. We're gonna have opening remarks from each of you, and then there'll be some opportunity for Q&A after that as well. So over to you, Hugo.
Lovely, thanks, Lauren, and thanks everybody for joining. I appreciate your time. So yeah, I've got 5 minutes to give you a bit of an overview. So we're talking about health, and the reason we're talking about health is because health is getting worse in the country. We've got some great ambitions to halve the disparity of healthy life expectancy for this new government, but at the moment the trajectory is not looking great. And if you care about health, you need to care about prevention. We can't just keep spending more and more money on the NHS. It can't continue to be a greater percentage of GDP. We need to do something to reduce the demand side of it. And if you care about prevention, the two big ones are smoking and what people eat. That's what drives a lot of the ill health in the country. We've got a pretty good idea on smoking. We basically want to get rid of it. You can't do that with food, right? Everyone needs to eat food, and so it's a more subtle problem. So there's this great ambition, but what do we do about it? So if you want to halve the disparity in healthy life expectancy, the sort of thing you're talking about to make that real is like 30%-ish relative reductions in things like obesity rates, smoking rates, rates of mental health issues. These are big changes we need to see. So that's the sort of level of ambition to kind of quantify it and put it in a prevention area. So if you're looking to do something like that, you need to do something big and different. And we're hoping that's what's being proposed here. To give it an idea, to get back to half obesity, which is Nesta's stated mission, that'll be bringing it back to the 1990s levels. What we really mean is an improvement in population weight distribution. obesity is a categorical thing. We're really seeking health across the population. There's an easy way to talk about it. That would require a net calorie reduction of about 220 calories a day. That's an average across everybody living with excess weight. That's not a lot, right? That should be achievable. It's about 8.5%. It's small, but it needs to stick, and needs to stick basically forever, over a long time period, which is very different to a sort of traditional diet approach. People have tried diets for a long time. Broadly, they don't work long term, and that's because people go back into a food environment that encourages them to eat unhealthily, or at least makes it hard to eat healthier. And that's what we're kind of trying to change here. So if you care about prevention, you care about obesity, you care about what people eat. If you care about what people eat, you care a lot about supermarkets, because supermarkets are where 80% of calories come from. It's where most people buy the vast majority of their food. And in the UK, 11 businesses make up the vast majority of that. So that's why we sort of zoned in on this healthy standards for supermarkets. And what this means in practice is incentivizing businesses so they consider health as well as profits. And we're talking about small changes to the food environment. So what this might look like in practice is changes to what products are on price promotion or not, where things are stocked in the stores, the portion sizes or recipes of different products, all within sort of the normal range, which is very wide of supermarkets. So the idea is, can you make everything a bit healthier? And that wording is really important. You want to make things healthier, not necessarily everything healthy. Laudable ambition, but unlikely to happen. If you ask people to switch from crisps to carrots, they're probably not going to do it. Whereas if you get people to switch from Walkers to Wotsits, that's maybe an easier switch for people. So we're talking about many small changes. And really importantly, you're not telling anybody what to do. That doesn't work. Telling people to eat better, it doesn't work long term. You need to create an environment that is conducive to allowing people to eat healthier, which is clearly the majority of people's stated intention. So in terms of the policy, we'll probably get into this a bit more detail in some of the Q&A, but it looks at using this metric called the nutrient profile model, which is already used in regulation in the UK, to work out the average healthiness of what's sold in a supermarket. And then the idea is to ramp this up a little bit. The metric it's a holistic metric of health. So it looks at all the stuff that you'd expect: saturated fat, salt, sugar, protein, fiber, that sort of stuff. We're talking about it particularly relating to obesity, but this sort of a broader health of food metric, which is really important. And what you'd be doing is trying to, our numbers at least suggest what you'd be doing is trying to move from an average of about 67, where 0 is really bad and 100 is really good, 67 to 69. It's a pretty small change. 67 is where supermarkets are on average, or at least they were in the data that we had from 2021. And 69 is a small improvement in that. And we think this can have a really big impact. We think our data modeling has shown that this can happen without there need to be any change in the revenue for basket. So that's either people needing to spend more money or supermarkets losing a bunch of money. So we think that's really good. And we can show that the estimated impact of this would be, roughly speaking, value akin to a 20% relative reduction in obesity. So if you link that back to the ambition on healthy life expectancy, reducing the disparities there, this is in line with that kind of level of impact. The key thing will be making sure that it's implemented properly, rapidly, that it is mandatory, that these things, that it's not watered down across the next process. So really pleased with the announcement, and now looking forward to what this means in practice.
Great, thank you, Hugo. That was a great opener to get us going and to specifically focus in a bit more on the healthy food standard. I'm going to hand over to Kat now at the Obesity Health Alliance and bring you in for your kind of comments and reflections.
Thank you. Thanks so much for having me. Hear me okay? Thank you for saying I'm an expert as well. I'm actually here today to be your cautionary tale. After 15 or so plus years in food policy, I want a little reminder for everyone. When we engaged back then and over the last 15 years on food policy, we didn't necessarily have yet an idea of how little movement had actually happened. We didn't have Dr. Dolly Van Teleken and Professor Martin White's excellent 30-year timeline of obesity policy failure. We hadn't seen the success of the soft drinks industry levy or the fierce commercial opposition to legislation. We didn't know about great international examples as well, such as Chile's multi-layered approach to tackling unhealthy food. Previous approaches relied on voluntary measures, largely reformulation, and a limited number of categories. We had pledges as part of the responsibility deal, pledges from food companies, and quite a lot of focus on personal responsibility. So it's amazing to see the shift in narrative in this 10-year plan as well, about not putting the focus on individuals. So over that time, yes, some reformulation did happen, but too often it was very limited and quite often gamed as well. The system shifted, but it didn't shrink. New categories popped up, loopholes appeared. All of us public health people had predicted and warned against in various consultations, and some of the rooms, I think Jim's in one of the rooms now in Department of Health, ex-Department of Health, we warned against all these things, but they still happened anyway. So if you'll excuse me with an analogy, not my one originally, I think it was Professor Susan Jebb's, this is what 30 years of voluntary food policy looks like. Every time we tried to squash, can you see that all right? Every time we tried to squash one bit of the problem, less sugar in cereal, less salt in ready meals, another bit bulges out. We have bigger portions, new products that are even worse than before, new ways of pricing strategies, new eating opportunities. We have takeaway deliveries now for breakfast and lunch. That didn't exist. Baby snacks for babies who don't need snacks. And the worst bit, I actually think the ball itself has got bigger. There are more calories, more junk, more clever marketing. So the net effect has not been less harm. It's just harm in a very different shape. But we have learned, and more importantly, I think government has learned as well. We know we can't rely on voluntary action or narrow targets. We need a system-wide approach, a really firm, mandatory, future-proof policy that can adapt to the future and not just react. And that's where we think, or at least that's where I hope, this new mandatory healthy food standards are going to be different. So we've learned a lot more than just voluntary doesn't work. We've also learned that this idea of the nanny state has been debunked. Politicians may still worry, but the public doesn't. In fact, polling shows really strong support for bold government action, especially when it comes to protecting kids. We've also learned that trust in the food industry is very low at the moment. Most people don't believe businesses are going to change unless government makes them. In our Recipe for Change polling, we found only 13% of the British public believe food companies will make food healthier without government intervention. We've also learned that people do like healthier food. They often prefer snacks with less salt and sugar. We have some great taste tests, which I might pop in the chat later with children for Recipe for Change, which proves it. Children saying that they either didn't notice the difference between lower sugar products or they preferred them. The healthy food standards that we're particularly talking about, I know there's a lot more. It's really interesting. It's ambitious, and it's hopefully a transformational initiative. So I'm going to come back to it. But of course, it's not the whole picture. You'd expect me to say that. To really match the scale of the challenge, we need a coordinated set of policies and incentives that work together to shift the whole system, not just on food, but beyond. But on food, that means delivering policies that have already been promised. So the multi-buy and advertising restrictions, which still haven't come in and they've been delayed and watered down. We also want this to be extended to out-of-home companies, brand advertising, and include those currently excluded categories. We think that retailers in the out-of-home sector could be supported to deliver these healthy food targets through upstream reformulation so that no one can sidestep that responsibility. And we can do that by introducing an unhealthy food levy as recommended by our Recipe for Change coalition. And of course, that can help fund access to healthier food for families too. There needs to be urgent action on commercial baby food, its composition, labelling, marketing, pricing. We need to strengthen procurement standards in schools, nurseries, hospitals. There were some announcements about schools, which is great. I was really surprised that the NHS didn't say that they were going to have much better procurement for healthier food in their own estates. We need to tackle that affordability gap as well, so the healthier food isn't out of reach for those that need us most. And we need that support go all the way across the system. We heard Wes Streeting talking about how hard it was to get prevention measures into the 10-year plan because he needs to get the buy-in across government, not just the NHS, the Department of Health, but also education, business, media, treasury, local communities. It all needs to be in there. But back to the healthy food standards, which I think is a very interesting approach. 74% of the British public think that food companies are not honest about the health impacts of their food. And now is a chance to really change that. And this is going to be different because the plan is to legislate. So first legislating on reporting the data so we can see what's actually going on. And then once we know what's going on, to be able to set targets to improve them. So what we need to see is Meaningful, transparent reporting. So Hugo's talked about some of the measures as well. We ideally would like to see the absolute amounts of harmful nutrients being put into the system as well, not just the averages and aggregated scores, ideally. And as this is probably going to be delivered through something like the food strategy, we mustn't also forget the importance of reporting on sustainability as well. We would like to see that reporting broken down by income, region, age, to show if it's working for all of those that need most, not just the worried well. Don't sort of hide behind those averages. We think that out of home and manufacturers should be included. So at the moment it says it's for large food businesses. So we hope that includes all of them. If we need to have a true level playing field, meaning it's fair for everybody, but also giving our taste buds a chance to adapt to new healthy flavors as well. That's really important. And we think the whole process should be just really open and transparent. All engagement, I think it was full, all engagement with industry is in the public interest. So we need to see letters published, meetings published, ideally held in a public sphere, as well as the data. Stop making us ask for FOIs, please. And we need it to be done at speed as well, because maintaining weight loss, as you guys said, is really hard. Reversing diet-related disease is even harder, but protecting the next generation is still something that's very much within reach. So we have the knowledge, we have the evidence, we've learned the lessons, now we just need the action. And that's where I hope all of us are going to come in, policymakers, public health researchers, campaigners, and the food industry. Because if we really want to wrap our hands around this ball and shrink it, we do need every single part of the system to step up. Thank you.
Great. Thank you so much, Kat. And I'm sure many of those lessons you mentioned there resonate with all of us working on food policy or in the wider policy space as well. I'm going to hand to Jim now to offer your reflections.
Thank you very much indeed, and great to hear from Hugo, Catherine, and David in a moment. Obviously, we've seen a really strong welcome for the plan from across the sort of spectrum of political stakeholders and senior leaders, policy community, professional bodies, patient reps, staff. And also what's really encouraging about the wider plan, but also the prevention parts of it, is very strong cross-party support. So I was in the Commons, for instance, for the statement last Thursday, and Jeremy Hunt was standing up saying he basically supported the plan. So it's encouraging that we've got a 10-year plan here that stands a reasonable chance of going the full 10 years without a next government hopefully deciding to rip it up and do something else. I'm part of a group of backbench Labour MPs, which includes a few names that you might be starting to become familiar with in the year that we've been elected. So people much more eminent than me, people like Dr. Simon Ofer and Becky Cooper, Peter Prinsley, Lewis Atkinson, other members of the Health Select Committee. We're a group of MPs who are sort of working together to take a health and public health focus, and particularly focusing on the prevention agenda that I think is very strongly represented in the plan. We had an initial meeting last year with Chris Whitty and the then Public Health Minister, and we've been very much a coalition of the willing since then, really urging the government on at every opportunity we can take to strengthen public health measures. So I was on the Bill Committee for Tobacco and Vapes Bill, as were others, initiating and taking part in recent Commons debates on things like obesity policy, the role of physical activity, and more. And so me and others were obviously very pleased when we saw the 3 shifts, which are very much the Darzi report shifts from the middle of last year, to see sort of prevention, the sickness to prevention journey as front and centre in the plan. And actually, I have to say, my residence in Dartford, so I held a consultation meeting on the 10-year plan, structured, but nonetheless giving people a real opportunity to say what they thought was important. Real welcome for the prevention shift, but also some of the measures that was going to require. Just to take it slightly more widely than just food, although food obviously is central to the way we're looking at this, I think it was really great to see Marmot right up there on page 1 of section 4. Not just a sort of commitment to joined up strategy, both primary and secondary in terms of prevention, but also recognising that this requires mobilisation across government. So closing the life expectancy gap becomes a properly acknowledged objective that we can then hold different parts of government and different parts of the both private and public sector that need to deliver this to account on. I think it also recognises the really full range of interventions that need to work together in terms of tackling low pay. That was really never a part of a serious part of government health prevention strategies for the last decade or so. Looking at employment, looking at early years, mental health, smoking, obesity, air quality, all of those things needing to work together and to understand the kind of interlocking nature of them all. And obviously building on the existing things that we've already said we'd do on smoking, so tobacco and vapes bill, but the junk food advertising, I know Catherine's had some comments on those, but the ban is going ahead. Ensuring the sugar tax doesn't just cover what it has historically, but also moves to milk-based drinks as well. So that was all stuff that we kind of banked and we were looking to move on from. So in terms of the action on determinants of good health, really a lot to welcome. So the mandatory food sales reporting for the large companies, congratulations to Nesta for championing this, but also all those other Food Foundation and other food stakeholders who have absolutely made that front and centre. I don't think I'm betraying too many confidences to say that I did have a chance to have a private word with Wes in the last couple of days, and he did compliment Nesta and other organisations for having championed that, and he was very pleased to have it as a key part of the prevention plan. I think there's some other things which go beyond food, so piloting the integration of employment advisors and work coaches into a neighbourhood health service. I think that's incredibly important, and we've got to understand how poverty and worklessness play into that issue around some of the drivers for unhealthy eating and consequently obesity. I think seeing some of the mental health support in schools to improve resilience of young people, again, I think that's an unacknowledged element in all of this, particularly when it comes to food and diet. I was really pleased to see, and this is just a little bit of a hobby horse of mine, the promotion of active travel and a real acknowledgement of its role in improving health outcomes, both in terms of air quality, but also physical activity. The last government was pretty much unreservedly hostile to that agenda, and it's brilliant to see it brought to the centre of a health agenda. And obviously some of the new delivery models locally, I think, are going to be really useful. Having said all that, I and colleagues really do want to see things go further, and we see this as a sort of start, but we really need to push some other measures, which we think we think there is a genuine encouragement for, but just didn't make it into the plan. So I think some of my colleagues are sceptical about how mandatory some of the work with the large food retailers, but food providers are. And we'll be really examining what that means in practice and looking to try and hold Department for Health and Social Care to account on it. We think we should have gone further with alcohol and minimum unit pricing. I think that collided with a sort of an industry lobby, as inevitably it always does, but we need to stiffen the spine a bit around that. I'm strongly an advocate of extending the principle of the sugar tax to high fat, salt and sugar products. And I think if I can trivialise it, there's still an appetite for that within government, and we need to really, again, push the government to do more. I think there's more that can be done on advertising, certainly, as Catherine was implying. And again, you have lots of friends within the Labour backbenches, but I know actually across all parties to work with on pressing some of those agendas. Just on air quality, again, I think there's more we can do on decarbonisation and really pushing that front and centre as a big health prevention measure. So as I say, not everything that I think will happen in the next 5 years is in the plan. I think there's still lots to play for in delivering the plan, obviously hugely in terms of delivering the plan, but also in some extra measures that I think can be levered in over the next 2 or 3 years with the right argument and the right innovation demonstrated by partners out there locally and nationally.
Great, thank you, Jim. And yeah, I think we're all keen to see even more come down the line. So great to hear that as well. I'll hand over to Dave now for your reflections on the plan.
Yeah, great. Thank you very much. And the problem with going last, of course, is that lots has already been said. But I really support a lot of what has been said. Obviously, we at the King's Fund really welcome the mandatory food sales and targets elements. So well done for all the work that all of you have done on that. There's also just a couple of other things, mention the welcome thing, a rollout of more mental health support in schools and teams, etc. And obviously connected to the Child Hubs announcement yesterday or the day before. Quite a lot of welcoming things like prevention accelerators. So in certain areas, particularly trying to push forward further on things like CBD. And also around the plan, but not necessarily in it, the changes to ICBs in several ways. One is obviously they're getting smaller, so there is going to be some disruption. And I think that is always a challenge to actually to focus on what's important. And there's no doubt that's disruptive. But also in terms of their new sort of stronger commissioning functions, a very strong focus on population health and as part of that prevention. So ICBs being retasked to some degree, but we're hopeful that prevention will be a much stronger element, perhaps, than it has been in the past. Also, an area that we sort of touched on a little bit was around devolution. So there are plans to try and align integrated care board boundaries with mayoral strategic authority boundaries. That's going to take a long time. That's going to be tough. Probably easier in some places than others, and that's not going to be quick. But potentially there is a potential really big win there around the wider determinants of health and much more coordinated regional sort of policy, connecting all of those wider determinants levers. It's a potential, so it's not thinking that in the plan and around it, those sort of those wiring changes are potentially very significant in the long term. And alongside that, wiring around sort of like budget alignment and paying for sort of outcomes. It's very hard to predict how that's going to go, I'll be absolutely honest with you. So there's a lot in the plan where you think this could be fantastic, but the devil is in the detail and in the implementation, and that's arguably one of its weaknesses. It's not arguably it's not a delivery plan, and there were obviously rumours that there would be a much stronger delivery plan alongside it, and we really need to see that. And how I'll be honest with the various ideas of change all come together and are made sense of for people on the ground in the systems, in the health service and in the partners in local government, and all the partners who are going to have to do a lot of the delivery of whatever gets decided at central government level. So you can see in the plan lots of competing ideas about that. And if I was on the ground now, I'd be saying, well, which one of these is going to win out, or which one of these is appropriate for what area? Because I really need that help to make sense and to help deliver the ambitions in the plan. Completely agree with what people have said about alcohol. That seems to be a very, very weak part of the plan. We were hoping for an alcohol strategy. I don't think we've had one since 2012. I could be wrong on the date. And there's been a conversation in the chat already about the connection between alcohol and obesity. And obviously, for some people, it's a very strong connection. So that's a good thing to pick up. I think there's also, from my perspective, a question of a bridge. So we have, I think, in the fullness of time, the sort of structural changes, the wiring changes could be very positive, but we have a gap before we get there. We've got a 2.8% real growth in the NHS or the DH budget, and we've got lots of other bits of government who haven't got as much growth. And I was hoping to see a much stronger commitment to local government public health in particular. Some of that, now that commitment might need to come from the DHSC rather than additional money from the Treasury alongside the plan, so from within the 2.8%. I was also hoping to see more about the public health workforce. So again, on the ground, some of the people who are so critical delivering and stitching all of this stuff up include the public health workforce. It's not just the public health workforce, of course, it needs lots of other people, but we're hoping for sort of a stronger signal from the government about how valuable that workforce is and the expertise and investment in capability in that workforce, and also the broader population health workforce. So that sense of a bridge from where we are now to where we want to be, I think, is something that the government really needs to work at with support and pressure from the rest of us. And finally, Jim, it was really great to hear you mention the healthy life expectancy gap metric. That's another area where we think actually there's been far less conversation, and frankly, things coming out. There have been a lot of things going into government on that, including from Leicester, I know, and lots of other colleagues about what does it mean to take that. And Hugo referred to that, but I don't think we've heard enough from government about how seriously that is really being taken, and how does this plan dock into that goal alongside all that other cross-government work. I think that's something that is missing, and we urgently would want to hear about from government. So hopefully it's a little bit. So I think very positive, but as we're all saying, there's a lot further. There's a lot further to go. We need to see more to really understand how this really makes the difference it really does need to make. Thank you.
Thank you, David. Yeah, I was going to say what I'm hearing kind of from a lot of the conversation is this sense of, very supportive of the ambition and excited to see the plan out there, and especially the emphasis on the shift from sickness to prevention. But much of that will be worked out in the detail and as we move to implement and deliver the plan as well. So I'm sure we'll all turn our attentions to that as we progress on. I'm going to move us on to the Q&A now, and I'm going to take the first question from in the chat there. So this is from Richard Daniels at the British Liver Trust. And I'm going to kind of focus in on the second part of this question, because I think we've talked a bit about kind of policy measures and things we're excited to see already. So if we had to kind of choose a policy within the current package to be campaigning on and driving forward, from those on the panel, what would be your kind of main things to go to? And I might go to Kat first on that, if that's okay.
Yeah, sure. I'll remind you a little bit about some of the policies that were in there. So the plan recommitted to key manifesto promises. So you'd have to assume they are pretty much the done deal. So restricting junk food advertising to children, limiting new hot food takeaway outlets, which is in the National Policy Planning Framework already, banning the sale of energy drinks to children, of which there will be a consultation soon, and creating a smoke-free generation as well. It also reiterated some previous pledges. So as you said, Jim, extending the soft drinks levy to milk-based drinks, changing the thresholds, expanding access to free school meals, review and strengthening the school food standards, and implementing the multi-buy promotions. So say they've either manifesto commitments or been restated. So again, you hope there's a fair amount of force and momentum behind those things. The new things are the healthy food standards, starting with reporting, an increase in the value of Healthy Start vouchers, updating all the current existing policies with the new version of the nutrient profile model, and other things around weight management as well, such as doubling access to digital weight management program. So the one that's starting completely from scratch is the healthy food standards. What we need to do as a sector is really align and understand where the best value we can get from this reporting. What do we need that's going to be able to show that there is some meaningful shifts in time? So we need to come together to that, just as the food industry will be as well, deciding what they are willing to share. And we know there's going to be elements of compromise that are included in that. And I think the first thing is just to make sure that we're sat at the table, really make those arguments about who's going to be sat at the table from the food industry, that they are all ones with good intentions, that haven't tried to undermine policy progress in the past or sue the government. And again, put those measures in about transparency of the process as well. So that's where we'll be starting, to try and make sure we have got as many voices from public health at the table, and then we're going to have to align and try and come up with some really good consensus points, ideally without compromising what we'd like to see as an end result. So the healthy food standards, I think, is going to be a really good and key focus for us for some time to come. But as always, start everywhere all at once, isn't it? But yeah, that'd be where I'm going to put my focus.
Great. I think I can probably anticipate what Hugo might have to add on this. So maybe I'll bring you in quickly on the back of Kat's message there.
Yeah, just focus on delivery, right? Like the advertising regs got announced in 2018. They're not coming until 2026 now. So it's very easy to think the job's done. And when it's really sort of almost just, we're through to the final now rather than having won the World Cup, right? Like there's still some serious work to do. And then just sort of more broadly, we've produced a website, the Nesta Blueprint, that rates 30 different obesity policies on impact, cost, and benefits and strength of evidence. And so we're going to be updating that in the next few months with specific childhood obesity aspects as well. But broadly, they track pretty similarly. Like kids get most of what they eat from supermarkets as well. So I think a common misconception is that as soon as people think about kids, your mind goes to school food programs and education, which are not bad things, but they are not the majority of what kids eat. And so the sort of, if you care about kids, you normally care about most of the stuff that matters for adults as well.
Great, thank you, Hugo. Dave, did you wanna add in, make your pitch for the one key policy to be campaigning for?
I guess it was a question, actually. Maybe that's not how we do this, but I think a very good point about the, you know, the again, wrong language, but the weight of supermarkets in all of our consumption. So that is a real positive around inequalities in a way, because it's such a universal, and it's become so much, and you know, over time, a universal place and system where we get all of our food. But there's still, I think, Hugo, the 20% that isn't bought from supermarkets. And I guess that it gets connected to me, so it's an open question connected to the inequalities question about how do we ensure that these healthy baskets are reducing health inequalities alongside reducing for the population as a whole. Really positive to hear you say, Hugo, that actually the overall net effect on the price of a basket is likely to be neutral, but nonetheless, just to make sure that whatever we do, we look beyond the 80% and what the 20% and how connected or focuses that around health. And it may not be, and you know the answer to that rather than I do. And then I think you're right about timing too. So when I read the plan, it wasn't quite clear what the timing was and when does the actual mandatory targets come in. It looked to me like, well, it might be could be beyond the 5 years, could be beyond the 5-year term, which then runs into new government territory potentially. So just making sure that we move as fast as we can, rather than slowing things down now that we've made this huge commitment.
Great, thanks, Dave. And Jim, did you want to come in with your kind of pitch of the one key thing to be campaigning on?
Yeah, this feels a bit like Dragon's Den, doesn't it? But agree with everything that's been said, and I think implementation is the key. But I will be very interested to see which supermarkets ambitiously within the new arrangements, the new mandatory arrangements, look to try and do some reformulation. And I think on the basis of any successful work on reformulation of the wider suite of food products, whether we can start looking at designing an extension to the sugar tax principle for HFSS. And so I'll be watching that carefully. And if there are some great learnings that come from that, then I would be very happy to be part of a coalition of people who look to try and, shall we say, push the envelope out around that issue over the next 2 or 3 years. So that would be mine. It's a little bit of a sort of at the outer end of what we need to be doing at the moment, but I think it's where the next push needs to come in terms of doing something ambitious that we've seen with the sugar tax has worked previously.
Great, thanks. And I might just also touch on now on the point that David mentioned, but also I've noticed a few comments in the chat which kind of speak to this health inequalities point and what we think the implications of the kind of wider prevention plan will be on health inequalities and those on lower incomes. I wondered, Dave, you kind of just spoken about it a little bit there, whether you wanted to come in more broadly on any kind of reflections of kind of what do you think the plan means for kind of health inequalities, and was there really enough in there to kind of address those disparities?
Yeah. So I think the second question first, I think the answer is no. Or there wasn't enough explicitly in there, let's put it that way. So I think every single policy in there can be implemented in a way that is better or worse for health inequalities. And I don't know whether, I haven't seen it, whether there's an equality impact assessment, for example, around alongside the plan. So I think we were hoping for much more on that, to be honest with you. Notwithstanding, and there's some things in there, you know, we do have the healthy life expectancy goal. Is it a target? Is it an ambition? Is it a goal? We don't know, frankly. It would be great, Jim, if you could help push that question too. And obviously the implications of each of those words is very, very different. And so what are people actually really working towards, and how serious is that goal? It was great to see it in the plan, I think I've heard that it was really hard to get it in the plan, I'll be honest with you, but it's great that it's there, that anchor is still there, but we need to hear so much more about that. And that connects to actually a much stronger, probably if you're going to hit it, both the sorts of ideas we found today, I know a much stronger sense of regional policy, and probably a much bigger sort of resource transfer than has been mentioned up to now by government, if we're really going to hit that or narrow that gap, because it's a massive goal, let's call it a goal. So we'd look to see that. But there are some really interesting things. So for instance, you know, we're streeting speech around looking at primary care funding and broader look at allocation of resources, and that's going on across government as we speak. What I would urge for government is to join that stuff up. We have the fairer funding review of local government. We have ACRA, the Advisory Council on Resource Allocation, looking again at NHS funding. We will have more integrated settlements to devolved administrations in England. All of that. So we need to make sure that all of that money as a whole gets to the right places. And around that, there's a strong accountability for health inequalities, both within place and between places. So we didn't see that in the plan, but I think that work needs to be done, and it needs to be aligned. All of this needs to be aligned to the government's espoused health mission, which to me, at least, my version of that is the healthy life expectancy gap as a critical goal. So the plan, it's got elements in it that speak to that, but it is not a plan that speaks to that overall goal in my view.
Great, thanks, Dave. Does anyone else want to come in and offer any additional reflections on that?
I mean,
can I just quickly?
Yeah, go for it, Jim.
Quickly say on that. I mean, I think, you know, there's no addressing health inequality without addressing inequality, which is a very obvious thing to say. But I do think this is a wider agenda for the government. So things like trying to get low pay up. So there's been a real focus on that in the first year, trying to get above inflation increases in the living wage and various other opportunities for people in work to be better off, because in work poverty is a huge issue that has really sort of accelerated in the last 15 years. So trying to address that, but also trying to address those other things which are going to give families an opportunity to thrive. So much better early years. Investment in housing is a huge one for me, which is a sort of no-brainer as well. And then underpinned by a kind of neighbourhood model in which I hope with kind of, you know, neighbourhood health, but also making some of the boundaries of ICBs and local government work better together, you can start to have some of this local work to really start to lift communities and individuals out of poverty, and therefore give them an opportunity to take advantage of then some of the things we're looking to do on health prevention, which David has talked about. And yes, closing the life expectancy gap is a goal, and we need to be pressing ministers right across government on how they're going to contribute to achieving that. And that is certainly something that I and my colleagues who I described before will be looking to try to make sure the government doesn't forget and really focuses on. So yeah, huge agenda there, which I think people do understand, and each of these pieces needs to contribute to.
Yeah, absolutely. And, you know, there won't be any great progress in reducing that gap without action on obesity as well. We have really great data sets out there showing where the disparities are across the country, but also people's dietary habits as well. So we really need to make the best use of the data sets that we've already got. So as well as linking up government and all these different policies, let's see what we've already got to hand. And that's where we can really focus the policy design. And I'm also really keen that there are measures in place as part of policy evaluations to show that it's moving in the right direction. If it's not working, we need to readjust and change how it's working. We can't continue to sort of worsen it. So some of these things need a bit of a test and learn. But say there's really good information out there. We need to make sure that's all fed in. So no, I do not think there has been any kind of impact assessment yet, but let's make sure we all contribute to make sure that that's really sound and solid and is addressing the core root of the problem.
Great, thank you. I'm going to move us on to another question from the people attending. So Amy Gandon's asked in the chat, and I think there was kind of a part one to this question, which was about the government's aims around growth and how that links or might be impacted on what they want to do on health as well. So the kind of question asks kind of, does the panel have thoughts on how far the government should go down the road on asking businesses to pay off and the savings that that might have for health more broadly? So I think the question here is essentially about the trade-off between businesses and health and what we might be able to kind of draw from that. I don't know, Hugo, if you want to kind of take that one first of all and offer some reflections there.
Yeah, sure. The interesting thing about this as a policy is that it shouldn't really hit businesses hard. That's kind of the point of it. So it's different from like a straight tax where there's obviously, a cost increase to people. And it's also different from practice-based regulation, i.e. the existing HFSS placement regulation, where you say, you can't put this there, you can't put that next to it. The absolute change that we're looking for, like on an average basket, is small here. We've done some work to sort of show what that looks like, and you sort of put them next to each other and they look basically the same. And that's the point here, is it's loads of small changes that would occur within a normal business cycle. So the implementation time for this is really important. We don't want it to take too long and go to the next parliament, but we want to give businesses a couple of years to get this right so that they can do it when they're next working out the recipe for the new product, when they're next refitting the store, when they're planning their next advertising campaign. So it's part of normal business rather than something that's additional to that. The modelling that we've done showed that you could hit these targets keeping revenue sort of constant. Now, that isn't quite profits, but it's the best thing that we've got for it. So we think that's pretty good. And so I'd maybe sort of slightly reframe the question as, what other types of interventions would you need to do to plausibly have this level of impact on health? Because a bunch of them cost loads of money in terms of delivery. GLP-1s are great, but they're expensive. And so what's the other option if the cost of healthcare keeps going up and up and up, and it's costly to either design specific practice-based regulation to pay for services or to tax things? Where does that leave you? We think that leads you here. So we think this should be, not detrimental to growth, at least in such a way that would be a net positive to society. If Tesco are only making more money because they're selling people loads more chocolate, maybe that isn't like the best type of growth. You need to consider the sort of externalities of this sort of stuff.
Great, thank you, Hugo. And I didn't know if anyone else wanted to come in on that, or I've also noticed oh, sorry, Dave, do you want to? I was just going to say, I've also noticed in the chat quite a few comments or a couple of questions about industry influence and the kind of role of industry more generally in kind of developing government policy, particularly around food as well. So I was kind of going to try and draw that into the conversation a bit. But did you want to come in first of all, David?
I was going to come back on the economic business side. So I think the first thing to say, we all recognise that there are many, many different forms of business and industries, from all the way from the tobacco industry all the way to a small local business employing people, which improves their health. So I think sometimes it's unhelpful to lump all of these institutions together. Nonetheless, what I was really pleased about to see in the plan was, and I think Jim mentioned this too, was emphasis. And again, this has come through the Get Britain Working white paper and the devolution white paper, is this connection between work and health and productivity and health. And we know that actually the ONS has some problems with its statistics at the moment, but broadly speaking, our health lags behind those of our competitors, which then is a drag on productivity. So the debate and nuance, I think, post-COVID between the economy and health has got much more nuanced, much more circular, much more two-way, which I think is welcome, that the economy and our health service are intricately related. So we've got to get this right. And the vast majority of the economy is delivered through private business, and taxes are paid through private business. So I think getting these relationships right is really critical, and there isn't a one notion of what business is. There's an OBR chart in the 10-year plan on one page of it. I can't remember what page it is, and the fact that our public services are going to be bust over time if we don't get the health of our population right is so critical. So so I think this broader relation between the economy and health and our public services is starting to become much more nuanced and much more helpful. And so business is a critical part of that. So business is a part of the problem, and it's a critical part of the solution.
Thank you, Dave. And I might just drawing, because I feel like it's a related topic, but not kind of exactly the same thing. But there has been a few kind of comments, questions sent in about how does kind of government manage the relationship with industry and protect some of the policy making space from that, whilst also kind of taking the experience and knowledge from industry into it as well. And I don't know, is it worth handing to Kat first of all on that one?
I mean, what a huge challenge. You know, the industry has got so much information. So the data I was talking about, the loyalty card data, they can tell us what people with lower incomes are buying. And they also have the technical experience as well about what they can do and what works. They've been doing it for years and years and years. We just want them to do it for good reasons and push us towards healthier things. So there is valuable experience that we need to listen to, but you have to approach it all with a critical mindset and challenge it. The only reason why there was such great eventual progress on tobacco control was because of the really strict protocols put in place for not being able to engage with tobacco companies. And as has been said before, we need to eat food. We're also miles away from that in the UK. If you read the press releases or heard the interviews, this is very much presented as being an industry partnership approach. So that's why we need to get in really early with what those parameters are. So things like transparency, making sure that you've got the right people at the table that are actually working towards public good, being clear that they can inform and share their data and information, but then it needs to be taken away and separately analysed and digested and decided whether that gets made into policy by the public health the health experts as well. So the health people will do the designing and then they can deliver it. We were always told time and time again, it cannot be done. We cannot make our cornflakes less salty than the sea. We cannot do this, that or the other. It's always happened. So just really going into that critical, challenging mindset and saying, show me the evidence, and then we'll show you the policy and you can please deliver it for us.
Great. Thanks, Kat. Hugo, did you want to add anything further on that?
Yeah, I mean, we do a lot of work with industry, right? And we're in this really fortunate position because we're a charity with an endowment where we can do that without any conflict of interest. So we can work with people, but no money exchanges hands, right? So then we try to sort of broker some of the insights there and say, like, look, in the trials we're doing with ASDA, this is the stuff that seems to be working. This is the stuff that doesn't seem to be working. This is the stuff that's genuinely been hard. This is the stuff that's maybe been a bit easier. And so we found that's been really helpful, particularly when talking about some of this mandatory reporting, because you can know that lots of these businesses already have this data. And so that it shouldn't take 2 years to get it in place. And so it's how do you, I think where we've come down is how do you involve industry in how you achieve something, not what the ambition is. That's sort of the key. We say, this is the target we're going to hit. You tell us how, you can give suggestions on how best to get there, but not how ambitious should we be? Because understandably, they have incentives to maybe water down that kind of ambition.
Just to quickly jump in, I mean, I think the way in which the food strategy work is developing, with Daniel Zeichner very much sort of leading that obviously as a DEFRA minister, but with links across government, I think that is the right template. Having people round a table, as Hugo says, not compromising the ambition, but talking about how we get there and the different policy strands required, I think is the way to go. And I just wanted to quickly answer a question. James Dick put a question in the chat about whether this will really get the sort of traction, this policy area gets the traction with number 10, the Cabinet Office, the Treasury, which is kind of the beating heart of government, that it needs, or whether it stays on the periphery and, shall we say, sidelined and therefore not given priority. I would just say that it might be unfashionable to say, I think the point of mission-based government and the mission around the health service, which was to sort of give everybody a good quality of life and provide a health service fit for the future, I think pushes some of this work further to the centre than might otherwise have been the case. And certainly the Cabinet Office is the guardian of those missions. And I think that's the way we need to work it politically, demonstrate how central this is to one of the core missions. And actually, it's no secret that if we haven't sorted out the health service to a much greater degree than it is now in 4 years, then we're probably not going to be very successful as a government and get re-elected. So that is a really big priority. So I think that's the way in, and I think that's the way to handle the ambition.
Great, thanks, Jim. I'm going to try and squeeze in one final question before we wrap up, and that's one that's also from James Dick in the chat there, and this is about whether the kind of government's narrative focused too much on calories and in their kind of 10-year plan, and what kind of reflections are to that. So, Kat, I might bring you in quickly on that one, if that's all right.
I mean, as usual, it's a fairly simple way of presenting things. Calories are for sure the issue. Excess energy intake is what leads to extra body fat, but we want to be moving people towards healthier and more sustainable diets overall. So the measure that's being talked about today, the nutrient profile model, it doesn't just take into account calories, it takes into account the negative nutrients, fat, salt and sugar, but also positive things like fiber and fruit and vegetables, which would include beans and pulses. So the idea is you're shifting people as part of those foods, if you want to improve those scores to more of those foods. So it is inherent as part of it. It was just perhaps not presented as such as part of the communications.
Great, thank you. Well, I'm conscious of time, and we only have a few minutes left, so I might wrap up there. I'm sure everyone will agree that there's kind of a million other questions we could have dug into, and I'm sure the debate will continue on as we kind of move into the delivery phase of this. So thank you so much, everyone, for joining us today. There will be a recording of this available to watch as well. Massive thank you to all our panelists for joining us today. It was a really interesting conversation, and I'm sure there's many more to come as we now move into implementation and delivery that we'll all get stuck into. So yeah, if anyone would want to kind of reach out to us at Nesta or others, then please do. We're always happy to engage in more debate, but hope you enjoyed it, and yeah, look forward to seeing where the 10-year plan goes from here. Thanks, everyone.
Thank you.
Thanks very much. Bye.